I mean, I don't know that we're ready to call things next generation CAR-T cells yet in myeloma. We don't have an approved product, so I think this is still first generation CAR-T cells for us. Yeah, I think that we saw more mature data from a couple of platforms. The Legend, now Janssen product, probably had slightly better overall response rates and perhaps slightly better progression-free survival, but I don't know that there's anything that really distinguishes the two products. They're going to get to the market hopefully in 2021 and clearly are going to be very impactful. I think one of the things that needs to be appreciated about the CAR-T cell platforms that are available for myeloma is that even given the sometimes less durable durations of response than we would like to see, they can be transformative for the patient. So, one of the things that people have to pay attention to is the difference between the progression-free survival and the overall survival. That patients recover, they go back to work, they go from performance statuses of 60 and 70, and they are then able to get sort of back into the arena of further therapy. So I think that they represent an extraordinary opportunity as a one-off, fully recovering therapy. So I think that they've been important. Now we've seen data on a whole bunch of different platforms from a variety of different companies, all with autologous CAR-T cell products directed against BCMA. And to distinguish amongst them, to me, is very, very difficult. I don't know that I would say, okay, here is clearly the best product. I thought the very interesting one was the update from Bluebird Bio of their BB2121 derivative. They're calling it BB21217. So the construct is exactly the same thing. The culture platform is slightly different, and clearly the durability, the persistence of the CAR in the patient seems to be significantly longer. The phenotype of the cell that is being administered is slightly different, and how much impact that's going to have is not absolutely clear at this point. But this early look at that is certainly very, very exciting. In the session that I chaired, the first presentation was by Sham Melakati with the product from Allogen, which is an off-the-shelf allogeneic BCMA-directed CAR-T cell product. The results of that study, to me, were very exciting. I mean, both in terms of the fact that they saw responses and the fact that the toxicity spectrum was not remarkably different than what we see for the autologous products. And the fact that they were able to consistently enroll on study, patient was treated the next week, is a remarkable advantage if we can do that. So there'll be other allogeneic products, both directed at BCMA and other targets. There's a SLAM F7 directed, a CS1 directed allogeneic product out there, and we'll see autologous products with different targets as well.